I'm a publican, so I live above the pub and I do have a lot of stairs. So climbing up and down the stairs is really hard. The pain has got worse over the years, really. I decided to come to see Mr. Bartlett. I did hear he was very good through a friend who'd had an operation. I wanted to come private because I couldn't wait any longer on the NHS. He's sent me for an x-ray, which I've had. He's told me it's definitely a total knee replacement I'm going to need because it's stopping me from living a normal life, if you like. I can't do anything with my family, you know, walking or going on holiday. So I really need this operation and I'm really pleased I'm getting it now. I've arrived today and I found them really, the hospital, the staff are really, really helpful.
They come in a few hours before surgery so that we can get everything set up. They meet myself and the anaesthetist and the members of staff who are going to be looking after them on the ward.
The room is really nice. It's equipped with everything. They've made me feel very comfortable.
I talk through the procedure so they know, just make sure they know exactly what to expect, although we've often talked through that quite a lot in outpatients beforehand, and go through a consent form, which is really to go through all the pros and cons of surgery one final time.
I've spoke to the anaesthetist. He's reassured me, you know, everything will be okay and I won't feel anything. I've been told I'm going to be staying in probably 9 to 10 days. That's not normal procedure, it's normally 5 to 7 days, but as I live in a flat with a lot of stairs, they're going to keep me in a bit longer.
Once the theatre spot comes up, we get the patient to come down. If they can, generally we like people to walk down to theatre where everybody introduces themselves, and then they go through into the anaesthetic room where the Benflon, which is a small needle, is put into the back of their hand. They breathe a bit of oxygen and then very gently drift off to sleep with the anaesthetic agents. Then essentially we bring people through into the operating theatre, which is this. It's quite a sophisticated modern theatre. You see this thing up here is a laminar flow enclosure which is specifically for orthopaedic surgery. So that blows ultra clean air down onto the whole of the operative site here. It's an uncomfortable procedure without painkillers, so our main job, both during and after the operation, is to make sure people aren't in too much pain, because it's vitally important to start moving the knee straight away afterwards. The physiotherapists work very hard with them to get the knee bending, and that's generally the major challenge over the first few weeks. We'd like to see people getting up to 90 degrees at least by about 2 weeks or so. It is uncomfortable. You swap the pain from the arthritis for the pain from the surgery.
Being told it's probably about 3 months before I actually start feeling the knee back, you know, how it used to feel, although it's never going to be the very same. I can't believe it's only 5 months and I feel close to being back to like doing the normal things I do. The only downside, I did put on weight, but that was because you're not able to do the things you normally do. But now, I've just joined the gym, so I'm getting back into the gym now. And as for Mr. Bartlett, he's been there, truthfully, all the time. I mean, we've got his number if we want to speak to him at any time at all. So I thought that was amazing. As far as I'm concerned, he's a miracle worker for what he's done.